What's up, everybody? Khaled Iwamura here from Insauga.com, and I'm going to get the mayor of Mississauga on Instagram live right now. So if you want to ask Bonnie Crombie any questions, comment below, and we'll try to get at it. Let's see if she's on. Bonnie, are you there?
I did it! Yay!
How you doing?
Hi,
How's your day
Kevin.
going?
How are you?
Good. How you doing?
I'm just racing back from the Mississauga Food Bank.
Oh, how's that going? The challenge?
We launched a challenge last week. Of course, our beloved Mohammed Faki put up $10,000 first and said, I will give $1 for every retweet. So tell everybody, please retweet the Mohammed Faki Mississauga challenge, and every dollar will get donated to the food bank up to $10,000. And then Superfan Nabadia got on board and he said he'd do the same up to 5,000. So we got lots of retweets happening. So we were able to raise over the weekend 127,000, and that sounds good, but their goal is 840. So we got a long way to go. And today, our frontline heroes, the firefighters Benevolent Fund came forward with, are you ready?
How much?
$100,000 donation, $100,000. So I'm so elated today. Just so relieved. So that brings our total to 227. And I know that will cause some more people to go on and hopefully donate. And tomorrow will be a little bit higher. And tomorrow we have a council meeting. And then I have a press conference following. And we actually have another donation lined up, a big secret surprise going to launch tomorrow. So fingers crossed, it's going well. But there are just so many people to feed. So many people have lost their jobs or laid off, and didn't expect the demand to be as high as it is.
Cool. And sorry, and how do they donate again? They retweet, right? And then they could donate to the Mississauga Food Bank, correct?
Well, Mohammed will donate up to 10,000 tweets, so for $10,000. So we encourage you to do that. Number one, retweet either Mohammed Faki or me, that counts too, or Naf Badia Superfan, the Mississauga Challenge, and they will both donate from their personal funds, 10,000 for Mohammed, 5,000 for Superfan. And if you want to donate, it's themississaugafoodbank.org. You can go right online and donate directly to them. And certainly they're seeing a real drop in food donations. So they prefer right now to have the ability to go out and buy what they need. So the monetary donations are going a long way.
Yeah. Insauga did a video about that campaign too. It got 10,000 views. So Mohammed texted me and said, thank you very much. So, yeah. So,
$1,000, yeah.
Yeah. So I'm just going to talk about something a little more serious. I was just talking to my friend, and he actually has a dad at Eatonville Care Center, and he has COVID-19 now. 25 residents, unfortunately, have passed away from COVID-19. So I got to ask what the city of Mississauga is doing for long-term care centers. I know it's more of a provincial jurisdiction, but I mean, at the end of the day, they're in Mississauga.
So I'll share with you that my own grandmother was a resident at Eatonville, so I know the home very, very well. She received excellent care there. However, what we are seeing now, let me preface that by saying that six of the past 7 days, 6 of the 7, we have seen single-digit increases. So whatever we were doing 2 weeks ago is starting to have an effect today. So I'm very grateful, I'm very hopeful, cautiously optimistic that we could see a peak to the increased numbers in the next week or 2 or 3. So I'm hoping that the end is at sight. We will see a surge, but it may not be what we had expected. Now our concern, and I saw that you were having Dr. Lawrence Lowe on board on the show, and you certainly speak with him, because the question came to me in a number of our town halls with families who had residents in long-term care facilities. Do they try and bring them home, or do they leave them there? And I will share with you that I know they're receiving excellent care. And of course, those residents are separated once there is an outbreak, so that they, the ones who aren't affected are moved away from the ones who are positive. And these are very tough decisions that need to be made in some cases, because obviously many of the seniors who are in the care homes can't be provided with proper care at home, and that's why they're there. Sometimes they need 24/7 care, and that just their families aren't able to provide it, or they have special needs, or they have Alzheimer's. So certainly the city is demanding, and we're asking Dr. Lowe to speak for us, that we need more testing at the homes. We particularly need all the staff to be tested. I've spoken up, and I think maybe you heard me last week say that part of the problem is many of the staff, they provide great service to the residents that they care for. They provide great care, but many of them work at multiple homes because many of them are part-time workers. So if one of the staff members is infected, it's very possible that they could infect multiple homes. So we have requested, and I know the Premier has now announced this as well. It came from BC because this is one of the protocols that they changed in the province of British Columbia, that these workers, other than being precariously employed, should be full-time providers at one home, not at multiple homes. And we think that will go a long way to stop the spread, because then you have, if there is a caregiver at one home, at least it's one home and it's contained and they get sent home. But we've asked that there be greater testing at all the care facilities. So we should know that if a worker comes in, that they have no symptoms, and that certainly the patients, the residents who live in those homes, they should be further tested as well, because obviously they're in close interaction with each other once they are in those homes, in the long-term care homes and the seniors facilities.
And I'll be asking Dr. Lowe tonight, but why haven't we tested everybody at the long-term care centers right now?
So, Dr. Lowe will tell you that I take my guidance from him, because at the end of the day, this is a public health care issue. It's a pandemic. It's not a sort of a windstorm or a flood or an ice storm. From natural causes. This is a health issue. So we take our guidance from our public health officials, and he takes his from the provincial public health officer, and the provincials take their guidance from Teresa Tam, who is the federal Canadian healthcare officer. And so, these are protocols that are put in place and they filter down. And, there were different protocols in place in different provinces as well. Certainly we saw last week or the week before that Ontario was really one of the lowest provinces for testing. If you came home from March break or you were symptomatic, we told you to go home. Go home, self-isolate. If you needed medical care, to call 911. But don't go into a test center, because you may not have COVID and you may be exposed to people who do, or vice versa. You may be COVID positive and you could expose other people. Just go home and self-isolate if you suspect it. Call public health so they're aware. So we weren't doing as fulsome testing, and I know you heard the Premier being very frustrated that there wasn't enough testing being done, and he demanded that 13,000 tests be done per day, and that's what he thought should have been the protocol. But we take our guidance from our public health officials, and so it's not for us to say, we don't think you're doing that right. We're not professionals. We take our guidance from them.
Okay. If you're just joining us right now, I'm here with Bonnie Crombie, the mayor of Mississauga. So with as much clarity as possible, because I get probably asked this more to ask you and ask the police chief, what is a finable act in the new social distancing bylaw? Because I'm not sure if you heard about the Oakville family that went rollerblading, and they were in a public, I think, parking lot, and it was empty, and they got fined. So tell us with as much clarity as possible.
That to me sounded like an overzealous bylaw officer, because at the end of the day, they were one family. So you can't have 5 adults unrelated together, although we don't recommend that. We don't recommend 2 unrelated adults not self-separating. And they were, a family outside trying to get some exercise, and they're having some fun. And they were a family that was self-isolating together. Now, I don't know the full story if the parking lot was closed or if it was, public space that they shouldn't have been in, because we've been finding people who have broken into public facilities that they shouldn't have been in. So certainly you heard of the 2 individuals that were using the skate park and parked in a closed parking lot. So they were fined because they were obstinate. They did not want to leave. They refused to leave. They said they were practicing safe social distancing, so they didn't have to. And that's not the case. We said these facilities are closed. You are now trespassing. They were issued $750 fine. There was an individual who decided it was a nice day to play golf. The golf courses are closed. He wasn't charged because he was alone. He wasn't charged under the physical distancing bylaw rules. He was charged with trespassing, which carried a lesser fine of $300. So they are looking for people who are gathered in a group, whether it's at home or in the park or wherever they may be, one of the hot spots in town, more than 5 individuals gathered who are not practicing safe social distancing of 6 feet or 2 meters, 6 feet. And I'll tell you, right after I left the food bank, I had to stop into Longos on my way home. I just stayed outside in the snow. I forgot my coat. I didn't realize I'd be outside, and they were marked 6 feet apart to walk into the lineup. And in the aisles, they were making announcements. Only 2 people per aisle. Please leave a distance of 6 feet 2 meters if you pass someone in the aisle. They were being really great, wiping everything down. Of course, I unpacked my groceries, came in and immediately washed my hands, put everything away. So the rules are 6 feet 2 meters, and no gathering in groups, and no using of public facilities that have been closed. So the parks are open to walk, but all the facilities in them are closed. And that means you can't climb over the fence of the tennis court to play cricket. Just saying. Okay. Those are other folks who got a ticket last weekend. They climbed over the fence. We've seen other people vandalize and actually cut through the fence so that they can get in. They'll get a bigger ticket because, of course, that's mischief. So the social distancing rules, if you are with a large group, you will be asked to disband. Our folks always try to educate first. We have fewer tickets because we educate first, and only if you are not cooperative, shall we say, not cooperating with officials, will you be issued the $750 ticket, or if it's trespassing, as the person who decided to play golf on a closed golf course found out, trespassing, $300.
So this might be a silly question, but I know it'll be asked, okay? How about if there's a family of 6 or 7 or 8 and they're out together?
Well, see, that's fine, as long as they're the family that are self-isolating together. We're talking about unrelated individuals, not more than 5 unrelated individuals. And the premier said 5. I think it should be 2. And since I'm the CEO of Mississauga, I declare it's 2. Lawrence Lowe, I hope you're okay with that. It should be 2 unrelated individuals walking 6 feet apart. And never mind 5. It's just not safe right now. The more strictly we apply these rules for a very short time, just to get through this period, we can get life back to normal. 2-3 weeks of this, and we can get our life back to normal. So please be strict in your application of the rules. 6 feet 2 meters with unrelated adults, unrelated individuals. If it's a family, of course. This is a family that's self-isolating together. This weekend was Easter. And I said the only people you should be celebrating Easter with is the same people that you have had in your home all week long that you've been self-isolating with. No extended family over. Those are the rules.
Now talking about, I hear people saying, go out there for exercise, while kind of, staying the physical distance of 6 feet. Now, is the city planning to open up more pedestrian-only type walkways or closing down blocks so pedestrians have a little more room to do things? Because every time we go out, we always go to the most popular spots, and they get popular and they get packed.
Exactly. So that's actually a very good question. You're reading my mind. Or you're perceptive, or you're reading all the press as I am. There are cities that are doing that. I know that Calgary has done it, and I know that Ottawa has done it, and we're certainly looking at it. In fact, we have a council meeting tomorrow because Mississauga continues to meet virtually on WebEx. We make decisions. We've been given the authority to do so by the province. These are very new rules that we can actually make decisions and vote on them and pass bylaws virtually. I do a roll call, and it's open to the public. So if you're bored tomorrow, Khaled, join us at 9:30. We'll probably go to about noon, and you can watch. So this is a question that I have asked our Commissioner of Transportation and Works. If we were to close down streets, which ones would they be to allow for, a greater availability of sidewalks and space for people to walk openly, so that, because some of our parks get crowded, as you say, like for instance, Rattray Marsh is closed because the trail, the pathway is so narrow, it doesn't allow people to pass each other, and it's in safe 6-foot intervals. So people said, why'd you close Rattray Marsh? It's a great place. We enjoy